Okay. We have two public health students coming to start us off.
Hi, everyone. My name's Bella. I'm a senior here at U of A studying public health, and I'm doing my internship at the Sonoran Center.
Hi, everyone. I'm Natalie. I'm also a senior at U of A, and I'm also doing my internship with the Sonoran Center.
So I just want to start off by thanking everyone for being here today. Today, Natalie and I will be sharing our work and impact within the Sonoran Center, specifically our contributions to the From Silence to Safety project.
So for a quick introduction, our project From the Silence to Safety focuses on improving sexual violence prevention for individuals with intellectual and developmental disabilities, or also known as IDD. People with disabilities experience a significantly higher rate of sexual violence compared to the non-disabled peers. Yet most prevention materials are not accessible, easy to understand, or designed with their needs in mind. This gap in accessible information creates real barriers to safety, autonomy, and informed decision-making. The Sonoran Center recognized this need, and our project aims to support communities across Arizona by creating clear, inclusive, and practical safety resources. Our goal is simple: to make prevention information understandable, usable, and respectful for individuals with IDD and for the people who support them.
So to address the gaps that Natalie previously emphasized, we focused on two main strategies. First, we created plain language information sheets on online safety and risk reduction. We took these complex health topics and translated them into clear, accessible content that individuals with intellectual and developmental disabilities could use in real life situations. And then secondly, we designed a coordinated sexual assault awareness month social media campaign. The campaign highlighted key safety messages, promoted disability inclusive prevention initiatives, and helped raise awareness about sexual violence and people with disabilities. Throughout this process, we collaborated with partners and reviewed the best practices to ensure that our materials were accurate and easy to understand. This allowed us to reach not only individuals with intellectual and developmental disabilities, but the communities they also participate in.
So for the results section, through this project, we learned several important things. First, plain language materials truly make a huge difference. They help individuals with IDD better understand these safety concepts and feel more confident in responding to the risk. We also saw that community-focused messaging increases engagement. So when the information is relatable and accessible, people are more likely to pay attention, share it, and use it. Finally, cross-agency collaboration strengthened the reach and consistency of our prevention efforts, Working together allowed us to create materials that were more inclusive and more widely distributed. Overall, our results show that the accessible materials and coordinated outreach were meaningful and improved safety awareness for individuals with IDD.
So overall, this work matters because accessible safety education supports autonomy, dignity, and informed decision-making for people with IDD. We learned that prevention efforts must address disability-specific risks, communication needs, and the systemic barriers that people with disabilities face. When communities understand these issues, stigma decreases and support increases. As trainees at the Sonoran Center, this project shaped the way we think about communication inclusion in our future roles within public health and healthcare. We learned how to create materials that are clear, accessible, and respectful, skills that are essential in any health profession. Moving forward, Natalie and I will carry these lessons into our professional careers and continue to prioritize inclusion and trauma-informed communication. This project reminded us that accessibility is not optional, but a core part of equitable healthcare. Thank you.
Starting it to be a Zoom. Are you on?
Yes, I'm on. Can
Hear
you
you.
hear me okay?
Oh, it's a little low, but here. I don't know if you can go louder.
Is that better?
That's better.
Okay, I'll try to project my voice. Um, okay, hello everyone. My name is Rashir Dobson. I am a third-year PhD student coming from Northern Arizona University. My program is in interdisciplinary health with a specialization in disability studies, and I had the amazing opportunity this semester in fall of 2025 to collaborate with the Sonoran Center as a policy fellow, also on the project From Silence to Safety, looking at risk reduction strategies for sexual violence among adults with intellectual and developmental disabilities. I also want to give a shout out to Dr. Lynn Tomasa, Gina Griffin, Barbara Brent, and Dr. J.C. Farkas, who really empowered me to do some policy research on this project. And so this poster is just a brief overview of some of our findings. Some of this work is still ongoing, but this is some of the policy landscapes we were able to uncover during this project. Okay, so adults with IDD report sexual violence as less than half the rate of non-disabled people. 19% versus 36% in police reports found that adults with IDD are reporting more incidences of sexual violence. And so just as one statistic pointed out a major systemic policy oversight in the state of Arizona. And so a part of the work that we were doing was looking at how Arizona frames sexual violence and sex education and how those two work in tandem with also mandated reporting laws and policies, not just in the state of Arizona, but also doing a comparative analysis. And so one of the widely misheld misconceptions assume that adults with intellectual and developmental disabilities lack the capacity to make informed decisions about their sexual health. And so we believe some of this inductive observation often drives research or research assumptions around adults with intellectual and developmental disability and their capacity to engage in sexual health and education. And research consistently refutes this claim. Studies also demonstrate that adults with IDD are capable of healthy and fulfilling sexual lives, and engagement in sexual education is directly linked to their ability to recognize abuse, understand consent, and participate in full daily life. And so just a quick overview of Arizona's policy landscape. Arizona is currently noted as an opt-in state. And the difference of an opt-in state versus an opt-out state is that an opt-in state, such as Virginia, it requires states to be able to opt in sexual health education policies. As we know, sex education is not federally mandated in the US, and so the opt-in or the opt-in policies are often left up to individual states. And like I said, Arizona operates as an opt-in state, meaning schools, they have to proactively elect to offer sexual health education. Nothing is provided by default. And so along with this project, I was able to do a state-by-state comparative analysis and looking to other states that have similar environmental and political backgrounds to Arizona, such as the state of Virginia, New York, the state of Washington, etc. And it showed us some interesting patterns that we're seeing across state line and also some gaps where Arizona might be able to model and providing sex education on the community and state level. And so the evidence shows that, like I said, people who have intellectual and developmental disabilities, when they receive sex education, they're better equipped to recognize abuse and understand consent, and also have reports of maltreatment. And this speaks to our mandated reporting requirements within the state and helping mandated reporters better support people with intellectual and developmental disabilities and bring down that incidence level of reporting and sexual violence prevalence among the community. And so in wrapping up, one of the other things that we found is there were just some standardizations that we can see across the policy landscape in the Arizona Developmental Council of Disability is working really hard to prioritize policy that not only prioritizes sex education, but also training and including adaptive and inclusive educations within schools and community-based organizations. And so they have also identified bipartisan participation is really critical to advancing meaningful risk reduction strategies for this specific population. But legislative progress remains slow and waning. And so, in closing out, I do want to say that when sex education is optional and reporting obligations are ambiguous, these populations, those with intellectual and developmental disabilities, they do carry the greatest risk and receive the less protection. And so, closing this gap is really purposeful of this work. And I'm really excited and honored to be a part of a project that cares about the safety and protection of the community and hoping that Arizona will continue in their ongoing efforts. Thank you.
Our final one for.
Hello, my name is Catherine, and I'm a master's in social work student at Arizona State University, and I am doing my internship at the Sonoran Center. I will be presenting on Understanding Me, a Healthy Relationships pilot program for young adults with disabilities. This curriculum was created by Special Olympics Arizona, and the pilot program focuses on providing accessible education about healthy relationships, boundaries, consent, abuse prevention, and sexual and reproductive health for young adults with disabilities. The original curriculum for this was intended for ages 18 years and older. However, the pilot program extends that age range to 16 years and older. This is important because relationship education, consent, boundaries, and safety skills are helpful before young people reach adulthood. By including participants as young as 16, the pilot can introduce these topics earlier and support prevention before harm occurs. One reason this topic is so important is because people with disabilities are often left out of reproductive and sexual health education. This creates a serious gap because they may not receive the same information, practice, or support around topics like consent, boundaries, and safety. The purpose of this pilot is to evaluate and adapt an existing curriculum from Special Olympics Arizona, and the goal of this pilot program is to see how well the curriculum works for participants and to identify which topics need support, more time, or different teaching strategies. It is also meant to increase participants' understanding of safe relationships, personal boundaries, and how to recognize unsafe situations. Adults with disability, young adults with disabilities are often at a higher risk for sexual violence than people without disabilities. Because of this, education is not just about learning information, it's also plays an important role in prevention. These topics give participants real-life knowledge and skills that they can use in their relationships and daily lives. One important observation from this pilot so far is that some topics were more difficult for participants to understand. This highlighted the need for ongoing support, different teaching strategies, additional time. Some topics such as consent or recognizing unsafe relationship behaviors may need repeated practice and need to be given simpler examples. The Understanding Me pilot program is important because it recognizes that young adults with disabilities deserve access to clear, respectful, and useful education about relationships and sexual health.
This program does not just teach information, it helps participants build confidence, practice safety skills, and understand their rights to a healthy relationship. By adapting the curriculum to participant needs, this pilot helps create a more inclusive and prevention-focused approach to sexual health. In summary, this Understanding Me pilot program is not complete and it is still ongoing. And even though the final outcomes have not been fully measured, I have observed the importance of this work. It's a safe place for young adults with disabilities to ask questions and receive clear answers. Thank you.